Okay, hi Jim. Thank you so much for joining me here and helping me discuss and talk about your chapter in Sick of the System. Your chapter title is Novel Virus, Old Story: Government Failings Put Healthcare Workers at Risk. So, Jim, tell me, why did you write this chapter? What was the main drive behind this chapter?
Well, thank you, by the way, Michael, for having me on and for actually, using this book in a very interesting way that you are. Um, I, I've worked in occupational health and environmental health for over 30 years, and um, but only recently became involved in issues around healthcare and healthcare workers. I had had a relationship with the Ontario Council of Hospital Unions for many years, but not so much on occupational health per se. And Margaret, Keith, and I were asked if we would help them. It first actually started with the Ebola crisis,
Mm-hmm.
because the union had been very influenced by what happened in SARS in Toronto, the SARS pandemic in the early turn of the century, 2002 and 3, and they were very concerned about this, like how were healthcare workers to be protected, because there was no clear plan for any of that. There was no training for it. There was really seemingly no organization about it. And at this point, the World Health Organization is saying, look, this could become a global pandemic. These people could show up in your hospitals, which is exactly what happened in SARS. So that started it. And then through this process with the union, it became clear that violence in the healthcare system was a very important issue. And it opened my eyes, because I wondered how, and for 30 years I've been involved in this issue, and I was completely unaware that violence in the healthcare system was reaching epidemic proportions. And in fact, it was so prevalent that it was becoming normalized. And so people just saw it as part of the job.
Yes.
And so this is an occupation in which, 80-90% of the workforce, there or thereabouts, are women.
Yes.
And so I was taken, like, how could such an issue? And as I started looking in preparation, they asked us to do a couple of studies on this. And in preparation, I started looking at the medical literature, and I saw hundreds of studies on this, that this was so widespread that it was being studied in countries all over the world. And of course, it shared this characteristic of a predominantly female workforce. And of course, violence against women in our society is also, normalized and accepted as, whatever. And so, as I wondered why I hadn't heard about it, why was it so studied? Why was it so prevalent and such an important occupational and human rights issue that I didn't know about it? Well, in the course of doing focus groups with healthcare workers across Ontario, which confirmed everything that we saw in the scientific literature, I learned that they were afraid to speak out, that they were intimidated, that their fear of reprisal was
Yes.
so strong that it kept the lid, so to speak, on this issue, and that outside of their own networks, people, I mean, they didn't see it as anything other than what they normally have to do, as they say, as part of their job. So this was very shocking and very disturbing to me, and I became very passionate about this. And then we did a second study on long-term care and violence, and the level of demoralization among the healthcare workers in these facilities, and what they described was the ongoing conditions for both themselves and the residents were horrifying, were shocking. And so we published these two studies. They were based on interviews of over 100 healthcare workers, 50 or more in the hospitals, and about the same number in long-term care. And we were in the process of, the union asked us to write up as a book about this, because they wanted to keep this issue going. They wanted to bring it out. And we went everywhere in Ontario and spoke about this, media conferences everywhere. It got very widely discussed and disseminated. But nothing was really being done about it, of course, because it's so connected to structures within the healthcare system. So when the pandemic first started, we were still working away on the book. We thought, oh my God, like this is going to happen. This
Yes.
crisis is going to unfold in this system where workers' rights and protections and needs are completely absent and unsupported, and in which they feel they cannot speak publicly for fear of reprisal. So it was like a perfect storm almost. And
Yes.
so, and I should say that given this experience we had looking at long-term care through this prism of violence and the possibility of workers being exposed to violence, made us realize immediately that the pandemic was going to be devastating in long-term care.
Yes.
Like this was before, we just knew it because of this previous experience, because we knew they had no supports, that the government regulatory system was totally absent, that they were precarious workers. They would work, 3 hours in the morning at such and such a facility, and then they would go to such and such a facility, and then maybe they would even do home care in the afternoon or evening or whatever. Like they had no steady employment. They were really in very dangerous situation before the pandemic. So imagining how little support and care there was there, and how understaffed and under-resourced it was, made us realize that. So we changed course and we collaborated with the union. And we're now doing a third study about the lived experience of healthcare workers. And part of that work was to write this chapter for Between the Lines.
Thank you, Jim. Thank you. That's very eye-opening what you've said. It's lots of food for thought as well. I was struck when reading your chapter and also hearing your comment now. There seems to be these two tracks happening to healthcare workers. On the one hand, they have fear of unsafe work. They feel at risk that they could be infected. They feel, and in some respects, abandoned. And then on the other hand, they have this other, if you will, fear of reprisals or fear of being fired if they say anything. So they're stuck between these two fears, it seems. And yet, it's not that we don't know about it, because as you mentioned in your comments today and also in the chapter, we had the SARS Commission, right? We had the SARS Commission that studied this in a way, a smaller kind of, I guess it was also a pandemic, but it was much shorter lived. And so in a sense, we have gone through this in a kind of a test case already, and we knew all of the recommendations from the commission, and we knew all of the dangers and all of the problems of austerity and cutbacks and things like that. So I'm wondering, Jim, could you comment on then what was the usefulness of the commission's report, and why or how did it not get implemented, I guess, right? Because I think that's often a question from the public. If we have commissions, if we have studies, if we have data, why can we not change the present, right?
Well, that's a very good question. And it's been one of the kind of shocking things for Margaret and I, because we've been participating with the union and in these government discussions. We've been fighting about the proper levels of protection, because scandalously over 6,000 healthcare workers in Ontario have been infected. They make up over 17% of the infected population. So clearly there's been a systemic failure. I mean, they're obviously not being protected adequately if, they're making up this level. You can imagine in almost any other work environment, if almost 20% of all the construction workers had mesothelioma, boom, the construction industry would be down,
Yeah.
So, okay. So about anyway, so I did, for preparing for the very first meeting I had with the government, Ministry of Labor, Ministry of Health, Public Health Ontario, which has all been, to me, so both familiar and disturbing at the same time. One of the first things I did was to read the SARS Commission report.
Mm-hmm.
And normally, if you're suffering from insomnia, a good place to go is a Royal Commission, because reading that, it's just wicked. But this report, this Judge Campbell, he got it. He really saw what had happened on the SARS Commission, because remember, over 300 healthcare workers developed SARS, and there was, I think, 2 nurses and a physician died from it.
Yes.
And they had, the healthcare workers had been arguing that they weren't being adequately protected. They saw it in front of them, and the public health agencies and the Ministry of Health and the Ministry of Labor denied their experience. And eventually they were vindicated. And so Judge Campbell looks at this experience. The very first thing he talks about, and he draws from the Creever Commission on tainted blood and so forth, saying we must employ the precautionary principle as a fundamental point for public health, that in the face of uncertainty in the terms of scientific understanding, if there is uncertainty and science is contested, we must err on the side to reduce the harm of the exposed population. I'm not giving it to you word for word, but essentially that's what it was said.
Even if the science is not, even if the science is not at 100%, we should err on the side of caution. Yeah,
that's right. Because the consequence of ignoring the potential for harm is so great that we have to go on the side of upping our game, so to speak. We have to go an extra steps or 2 to reduce, because what happens if we have made a mistake, which is what happened in SARS, which I would contend is going on right now today in the current pandemic. And so he stated that right off the bat, and then he raised this experience of them fighting over the respirators and saying what was wrong, why they needed the better level of protection, the N95 respirators versus just a surgical mask, and the importance of having to listen to the healthcare workers. I mean, really, it was an unbelievable critique of what had happened. And then he lays out all these things that must change, and how the Ministry of Health and the Ministry of Labor must create this culture of safety, he called it, in the healthcare industry, in the hospitals, and by extension, long-term care, where, the voices that, first of all, that health and safety would become paramount to the functioning of these institutions, and that the workers themselves would be seen as central, that their health was central to how the hospital and these institutions would function. And he had very concrete, steps on all of this, and what was to happen, and what the Ministry of Labor should do. And so I'm reading this for the first time. We had been to some extent involved in the SARS Commission. Our clinic staff had gone and made presentations and assisted and so on. So I was familiar with I hadn't read the report, but I was familiar with kind of the general concepts. When I read this, I was thinking, given our experience with studying violence, one of the things that we learned right away was that the regulatory system had collapsed. The occupational health and safety committees, which are mandatory, were barely functioning. The Ministry of Labor was nowhere in sight. So all these things that Judge Campbell said were essential and that must happen, the governments had actually, both liberal and conservative, had gone the other way. They had dismantled both their supplies for respirators and so on, but also the structures that would have ensured that there would be these kinds of protections. So I think I think that's my real takeaway from all of that, that we really did have a very robust, thoughtful report, a plan, if you will.
Yes.
And I'll just close on this point, that in all the meetings I've had since, I've been involved in, 6 or 7 Zoom meetings like this type of thing, including Margaret and I giving presentations about the scientific literature showing it, these respirators are absolutely essential given how the virus is transmitted.
Yes.
Not once was the precautionary principle or the SARS Commission report used as a guide, like the unions had to assert, and we did, that this was the report from which our decision making should happen. But it's not to be seen anywhere on their agenda. It's not the guidepost that we thought it should have been and we expected it would have been.
It definitely is enough to make you become a cynic about the value of commission reports, So.
Yeah.
So then, Jim, what would be if I'm reading this collection and I'm reading your chapter, what would you like the reader to take away from it? What's the number one takeaway that you're hoping the reader gets from the chapter?
I think what's going on in our healthcare system is a lens from which we should look at the broader issues in our society. What we value and what's important, and how we treat one another is really, you can see it in this situation.
Yes.
And we're in a certain way, we ask the healthcare workers to be firefighters and jump into the fire without any protective equipment on.
Yes.
Because they were supposed to, save us and save the lives of people who had been affected. But they themselves weren't treated with the kind of respect and support that such a demand should make. But I think what it exposed to me as the violence issue did is the systemic sexism, racism, classism in our society, and how government decisions about the economy and what I generally call neoliberalism, where the government deregulates, corporations are given free rein, the market, settles everything. All issues are your personal responsibility, whether it's getting an education, getting medical treatment, getting a decent job, and all of those things. That at root, the crisis that we're in, that the pandemic exposes, is rooted in this economic system of which the Canadian government, the Ontario government, the BC government are all a part. And until we see our economy and our governments and structures playing a different role with a different set of priorities, we are going to lurch from this crisis to the next. And of course, I'm thinking very much about climate change and the crisis that's pending. If we think that the pandemic has been a crisis,
yes,
well, what's in the offing here is beyond that. And so we have to really reconfigure the world we're in. And it seems a very high demand for people feeling, in general, being made to feel so powerless. So I don't know if I've captured a succinct point, but it's what I'm left with.
No, I think what you said is quite clear. Yeah, thank you. So I just have one, and I agree with that, absolutely. So I just have one final question, which is, you wrote this in April, basically, or you co-wrote it with your other two co-authors. Would you change anything now? So that was April. We published in the middle of May. It's been a few months, and there's been quite a lot of different, I guess, global changes and new data and new political events. Different things have happened since then. Would you change anything or update anything, or would you add something, or would you subtract something?
That's actually an interesting question. I don't know if I mean, unfortunately, the rate of infection for healthcare workers has stayed about the same since we wrote it until today.
Oh,
although the scientific,
I didn't know that. Wow, that's now I'm a bit shocked. I didn't know that the rate of infection is the same. Has not changed
yeah,
for healthcare workers.
no,
Oh,
and I think in some places, I think British Columbia, the rate is even higher. I think it's closer to 21% of the cases are healthcare workers.
yes.
And in Quebec, of course, it was very, very disturbing situation there. So, I mean, and the government hasn't changed its position on any of this. They haven't upped the level of protection that, this high rate of infection among healthcare workers hasn't generated, you know, major actions on their part to get these supplies and to use powers to make sure that they're manufactured and in sufficient numbers and this type of thing. And you can go on with the testing and with the contact tracing, and all of those things have essentially been left in the same state
Mm-hmm.
as before. So I think pretty much what we've written has remained about the same, and maybe by extension worsened, because now we have more and more evidence that their whole approach was mistaken, and yet
Mm-hmm.
there seems to be no accountability for that. Again, under kind of the neoliberal regime, you pay individually. So
Mm-hmm.
if you got sick, that was too bad, but it must have been something you did, and not how
Yeah.
it was organized.
Yeah.
I think my one thing, if I had, to say something more about the book as a whole, I think one of the most missing pieces, and not because of between the lines or the editors or anything, but just because of the difficulty of assembling all of this, was the story of the migrant farm workers,
Ah, yeah.
which
Yes. Yeah.
along with long-term care and what we've done to our elderly citizens are the two most glaring public
Mm-hmm.
manifestations of what our society, how it really functions. And I think that's the takeaway for me, and maybe is for students or
Mm-hmm.
others who read this book, is to be mindful that these stories, these experiences, these look at First Nations experience,
Mm-hmm.
the experience of the gay movement, and healthcare workers, and others in our society, really exposes some very deep problems that we're jeopardizing all of our collective futures by
Mm-hmm.
ignoring.
Well,
And
you'll be happy to know, Jim, that any profit from the book is being donated to the Migrant Workers Center. So
I thought that was
yeah,
brilliant thing that
yeah,
Between the Lines did, and a very and I know, actually, I mean, just to be fair, they did try. I mean, they were looking to have this story told, and
yes. It just didn't work out
circumstances
with our
didn't allow
timeline.
it.
Yeah,
That's right. But I'm just saying that that's the other thing for people to be mindful of, that's the experience of the migrant farm workers should teach us a lot about how the Canadian government functions, how our agricultural system functions, what it means to be a minority, a person of color,
yeah,
because it's all so connected.
yeah. I mean,
When they are ignored, what happens?
well, I think it's quite telling that we make into heroes our frontline workers, our so-called essential workers, the person at the grocery store, the nurse, the doctor, the bus driver, the truck drivers. But it seems like no one has said one of the heroes is temporary migrant workers. So it's kind of
I
interesting.
know,
No one has said that, right? Yeah. I don't think
right?
it's been said very much. Yeah.
No, because their voices, like the healthcare worker voices, are totally muted.
Yeah.
They're not allowed to say anything for fear of being deported. It's the whole
Mhm.
use of reprisals to keep our most powerless and exploited portions of the population quiet and at the margins. And that's why what you did with the book and bringing these stories forward was so important, because it
Thank
brought
you.
those voices.
Okay, thank you so much, Jim. That's been so eye-opening, and great to hear your voice and see your face and put a put a face to the words too. So this is really great. So thank you so much.
Oh, Michael, thank you for doing this.